day everyone, I am Magsombol from BSN1-Y3-M10B. So today I will be doing my written demonstration about transferring of patient from bed to chair, then chair to bed. So first, I will be doing the bed to chair. So I will now check the doctor's order and the client's diagnosis and restriction. This is to determine any contradiction and limitation on the client's physical activity. So, sir, can you raise your hand and grab my forearm? Okay. So, since the patient is able to maintain the grip on my hand, forearm, I will now proceed to the hand washing. But I already done the hand washing procedure, and this is to prevent the transfer of microorganisms. So next is to obtain the equipments needed. But since I will use a chair, I will check the condition of it just for the
safety of the patient.
so I already obtained the equipments needed and checks its condition. I will now identify the client about the desired purpose and this destination. This is to prevent the client's anxiety and increase cooperation. Um, Sir, are you comfortable with your position right now?
Yes.
So, since the patient is comfortable with his position, I will now adjust the height of the bed to the lowest position. This is to reduce a distance that the client has to step down from the ascending risk of injury. So next is, since I already adjusted the height of the bed to the lowest position, I will slowly raise the head of the bed if not contradicted. But since I do not have the adjustable bed, and the patient is already comfortable with the position, I will now proceed to the transferring of the patient. So first is to adjust the legs of the patient. I will first remove the linen. So first, before I will adjust the patient to the side of the bed. So next is the put the hands of the patient in his back, and the other one is on his leg. So next is to adjust the patient's legs. So I already placed the patient's one arm under the client's leg and one is behind the client's back. I will allow the patient to dangle for 2 to 5 minutes. Since he's done with his dangle for 2 to 5 minutes, dangle allows time for assessing the client's response to sitting, redness, possibility of orthostatic hypotension po. So next is to bring the chair to the close side of the patient and at the 45-degree angle. This is to so since I'm not using a wheelchair, I will now proceed to the next step, which is the lift the patient and put the transfer belt on his lower of the ribs of the patient. First, I will ask the patient to put his hands on my back before I place the belt. Okay. I will now put the transfer belt to the patient. And I will now carefully lift the patient to the chair. I'm now done with the transfer of the patient. I will now unbuckle the transfer belt and allow the patient to remove his hand to my back. Sir, do you feel any discomfort right now? So, after transferring the patient from bed to chair, since I am done with the procedure, I will now proceed with the hand hygiene. So, since I am done with the transferring of patient from bed to chair, I will now transfer my patient from chair to bed. So, first is to ask the patient to put his both arms on my back and put the transferring belt to the lower part of the ribs of the patient and buckle it. Then move the patient carefully from chair to bed. Then unbuckle the transferring belt. Then I will ask the patient to remove his arms to my back. Sir, can you please remove the... So, I will ask, next is, I will ask my patient to put his both forearms to his back. Sir, can you please put your hands on your back on a cross position? So, after that, I will carefully grab the patient's shoulder and the leg part and carry him slowly and put him in a comfortable and supine position. So, since I am done with the transferring of the patient from chair to bed, I will now I will ask the patient if he is comfortable with his position. So, sir, are you comfortable with your position right now?
Yes.
So, since the patient is comfortable with his position, I will now put the blanket to the patient to provide some comfort. So, I am now done with the transferring of patient from bed to chair, then chair to bed.